So, Dr. Sandberg, one area we didn't touch on at all is really erectile dysfunction, risk pre and post treatment. And do you have any perhaps preemptive options you'd like to discuss with the individuals tuning in tonight, and maybe some of the interventions that you do post treatment?
Yeah, sure. So I do think that it's important to have a discussion around erectile dysfunction as well because it affects a lot of men. I would say based on the data, more men actually after prostate cancer treatment than urinary incontinence. And the degree to which we mentioned this earlier, but the degree to which you focus on that really depends on the man and how important it is. It's important to know, are they sexually active or not? Do they plan to be afterwards? And what is are they married? Are they dating? What is the status of what their goals are so that you can help them through that. I think, first and foremost, erectile dysfunction can sort of be a first signal for other health issues. And so I talk to guys, about things that can affect erectile dysfunction beyond just treatment from prostate cancer, but they can be things like diabetes, obesity, cardiovascular disease, hypertension, other medications that they might be taking for other medical conditions, prior surgeries that may not be related to prostate cancer per se, but could be related to the GI system or the rectum or whatever it might be. And so trying to optimize their health from all those standpoints prior to undergoing prostate cancer treatment can be important. The other thing is there is some evidence to suggest that like a coin was termed several years ago called penile rehab for men who have undergone prostate cancer treatment, which is the early intervention of use of medications like Viagra and Cialis, as well as possible incorporation of a routine with a vacuum erection device or a penis pump to help keep blood flow within the penile tissues as much as possible post-operatively or post-radiation to help recovery of erectile dysfunction. Because many men, maybe upwards of 50 to 75%, will have erectile dysfunction within the first few months of a radical prostatectomy, for example, but a large percentage of those, more than half, will recover their function back within 12 months. And so I work with those men early from a overall health standpoint with use of medications. And we typically start with oral pills and medications. We start with things like vacuum erection devices if they're willing. But if those aren't enough, then there are also injection therapies that can be provided to the penis, which are medications that don't rely on the metabolism of swallowing a pill and having it get into the bloodstream, but are going directly to the source. There are newer therapies out there, ultrasound shockwave therapies to the penis that are still relatively new, but being further investigated. And then from a surgical standpoint, if those methods are not working, then there is also a surgical option to implant a penile prosthesis to allow the man to have a rigid penis and regain the ability to have an erection. And so, many men aren't aware of that, or they had a prostatectomy 10 years ago and are just learning about it. And that can be, eye-opening for them. And it's important to know, similar to one of the other participants' questions, if it has been 5 or 10 years, that's not too long of a time for a man to still potentially recover sexual function, with or without a penile prosthesis surgery. And they come in different shapes and sizes and sort of configurations. And those are all things that we talk about in a visit like that.